A very good morning to you, and thank you so much for joining us this beautiful Friday morning. Glaucoma is often called the silent thief of sight, and that's because it quietly damages vision long before most people notice anything is wrong. Today, we continue our glaucoma awareness series on Solid 100.9 FM in partnership with the Eye Specialist Hospital, Enugu, bringing you life-saving information that can help protect your vision and the vision of your loved ones. This morning, we're focusing on medications for glaucoma, the different types, how they work, why consistency matters, and the dangers of self-medication or irregular use. Glaucoma is currently one of the leading causes of irreversible blindness globally and here in Nigeria, yet timely treatment can slow or even halt its progression. Of course, joining us this morning, we have Dr. Sohanyo Keke, an experienced ophthalmologist passionate about community eye health. She will break down everything you need to know in simple, everyday language so that you can make informed choices. Dr. Sohanya, good to have you this morning.
Good morning and good to be here.
Okay, let's start with some foundational questions. In simple terms, what exactly do glaucoma medications do inside the eye?
Okay, thank you for that beautiful question. As of now, we all know glaucoma is a blinding eye condition for which the intraocular pressure remains the only modifiable risk factor. So far, the treatment of glaucoma revolves around adjusting this intraocular pressure. This intraocular pressure is just like the blood pressure we talk about. Is the only objective way we are assessing your pressure in the eye. Now, pressure in the eye is called the intraocular pressure, and you want to modify it. And this modification can be achieved through medications, surgery, and laser. But today we are going to be talking about how medications modify the intraocular pressure. Now, when it comes to medication, before we go into the medication, we need to learn a little bit about what intraocular pressure is.
Okay.
The normal intraocular pressure is between 10 and 21. Anything above 21 is considered high eye pressure.
Okay.
Now, we are not talking about low eye pressure less than 5, because certainly there are cutoffs that are different, so we don't go into that. But we have come to understand that in the African race, the glaucoma prevalence and the risk factors, the way the glaucoma moves, we may not actually wait for that 21 to be reached.
Okay.
Most of the time, when we take a look into your eye, intraocular pressure is one of the factors we are considering. We are evaluating your optic nerve head.
Okay.
Optic nerve head is the wire that get all the impulse. Whatever you see is just like a cable that sends every information to the brain for interpretation. You know, all these things happen in milliseconds, so you don't really know something is happening. So something is happening to the optic nerve head, and if that optic nerve head has some signs of damage, that means the pressure may be high or some damage is going on even at normal pressure. So sometimes you have glaucoma coming at high pressures, sometimes you have glaucoma coming with your normal pressure, or we call it the low tension glaucoma.
Okay, that may be deceptive.
So it is very good to know that you can have
Normal eye blood.
eye pressure of 10 and even 8, you are still having damage going on in the eye. That
Wow.
is why when the eye doctor sees you and puts you through all the checks, the different tests, the central visual field, the pachymetry, optical coherence tomography, these are studies of the optic nerve head and how much you are seeing by the periphery, the side vision. Then he now thinks, yes, you are a candidate who has to be treated or you are kept under vigilance. Now, in terms of intraocular pressure, there are two mechanisms. We have also talked about open angle glaucomas and angle closure glaucomas, but most of the medical treatment involves the open angle glaucoma, so we'll be restricting our discussion for the open angle. Now, what really happens in the case of open angle is that you just liken your kitchen. In the kitchen you have a sink, and in this sink your tap is open. When you open the tap, you have a filling, the water should drain and it should go out. That's the normal pathway to water flow. The eye mechanism is just like a plumbing. All human body is like plumbing, electrical activity going on. So many things are likened to that. So the workings of intraocular pressure is more like a plumbing mechanism whereby the water goes out and it has to go out. But in the case of open angle glaucoma, this tap is open, the filter there is still open, but for some reason the water does not flow out. This is in the eye, we call it the aqueous humor. The water in the eye is called the aqueous humor, and that is what concerns the eye pressure. Now, when the liquid aqueous humor does not have a path through which it moves, it now builds up pressure for you. And when the pressure builds up, it's like a weight is sitting on the tiny nerve. That is the optic nerve. That's the cable I was talking about. It's like putting a cement bag on top of an egg. That is what is happening. So when the pressure goes up, it just begins to affect the nerve and the nerve begins to die off. Okay, now to reduce this eye pressure, the aqueous humor in itself is not just formed just like that. It is formed by a structure called the ciliary body, which is just around the lens, is holding behind the lens. So what happens is there are two mechanisms you are going to be tackling. One is to reduce the production of the aqueous humor. That is, you don't want it to be produced so much so that there is no build-up of the pressure. The other one is passage. Can we increase alternate pathways through which there is what you call the trabecular meshwork. It is like a drainage pathway of the eye through which the fluid drains out. Some of these drugs increase the trabecular pathway. Some of them, there is another outflow channel called the uveoscleral pathway. It is an alternate channel, so it drains out. So the mechanisms are like two. One, we are aiming at the secretion. Can we reduce the secretion? Can we push out the water? That is outflow channel. Inflow and outflow we are targeting. So some of these drugs are aiming at inflow, some of them are aiming at outflow. So we have different classes of drugs that do this work beautifully in the eye. And over time, so much research has been done, so such that, when you are giving a drug, one of the things you want to be careful about, it is not always easy for patients to use it all the time. So manufacturers, researchers have always researched on information. How can we improve these drugs and how much percentage each and every one of these drugs can bring down But the problem is that we also know that they are drugs. Drugs are usually chemicals. When you introduce a drug into human body, it is not that they are going to work only on that. Sometimes it gives you some side effect.
Okay.
Okay. So these are challenges we need to encounter, and at some point you know that this pressure causes more havoc than the side effect you are considering. Therefore, it is still beneficial to you. That's why these drugs are prescribed. So now coming to the drug, we have several classes of drug. Let's start from the prostaglandin analogs. They are quite friendly. It targets the outflow channel, especially the uveoscleral pathway. Now, it has a percentage reduction of 25 to 35%, okay, of eye pressure. So when you use it, your pressure can actually reduce by 25 to 30%. That is, if you have an eye pressure of 20, you are looking at a drop like 5 to 6. No, uh, so that is the range it can bring it down. Usually, before a drug is prescribed, the doctor assesses you. After assessing you, based on the stage of the disease and the severity of the disease, he sets the eye pressure that will be good for you. We call it the target pressure. When you set the target pressure, it is based on the parameters found in your eye. It
Okay.
is target pressure is the pressure below which we do not have further damage to the optic nerve head. That means this, for it is highly individualized. It's customized to each and every patient based on his parameter, age, corneal thickness, severity of the disease, and all that. So each time you come to the hospital, the eye doctor checks and sees that your eye pressure is within that range or above that range, so he can now modify the drug. So this latanoprost we are giving can lower the eye pressure 25 to 35%. And the advantage of this drug is a once daily dosing. Usually it is given in the night. It can be 7 p.m., 8 p.m., 9 p.m., depending on your convenience, but it is once daily and it can work beautifully. But it is not that it is without side effect. Some of the side effects are that you can have redness in the eye. We call it hyperemia. That over time the eye gets red, very red. Those that are very steady and using it over 10-15 years, you will see that it can also give rise to pigmentation, brown color. The eye is no longer looking white, it is brown. It is just tell you that this patient has been quite consistent with his medication. Now, apart from that, it also lengthens the eyelash. Some young girls like it because they look for artificial lash, but it lengthens the eyelash. But sometimes it is not just lengthening; it can also increase the number of eyelash. Sometimes also it increases the pigmentation of the iris. Prolonged use can also lead to atrophy of the fat. So
Okay.
the over over time you have a feeling that the eye is receding inwards. This
Okay.
happens to those that are using the eye drop only in one eye and not in the other eye. So sometimes you feel that one eye is looking normal, the other eye is going inwards. Such things are possible. Sometimes we give some preservative. There are preservative free eye drops which have less side effects than this, but the problem is the preservative free ones can still be costly. So but they are also available. Then the other class of drug is called the beta blockers. They are quite friendly. They are actually very friendly, uh, but has its own side effects also. The
Okay.
normal preparation, I don't want to call brand name, we are not sponsoring anybody. So you have the beta blockers, they come as timolol, timosol, chromosol. They have different brands and different makes. Now, the advantage is that you can use it as only once a day, or you can use it twice daily depending on the convenience of the patient, but either way it is effective. Now whatever it does, it reduces the eye pressure between 17 to 22%. So it has its own capacity of reducing as the eye pressure. Now, unlike the prostaglandin analog, this one is now used acting at the secretion level, at the input, that it reduces the production of the aqueous humor. That is where it plays its role. But where one has to be careful is that there are classes of people that may not be too comfortable taking these drugs. Those that have some BP, hypertension, those that have asthma, lung disease from any form can have some problem, and you must always let your doctor know if
Okay.
you have such challenges, because you can have breathing difficulties when taking your medication. So it is important to let your doctor know, because in that case there are drugs that are what are called the cardioselective in the same beta blockers. Those drugs may be chosen in place of the beta blockers itself. There is a different class. Now, one of the advantage is also that it is relatively cheaper than most of the available glaucoma drugs, and it is found in almost everywhere, and one of the oldest drugs. So even in places that if you have forgotten and go to a village and you are looking for a drug, maybe this is a drug that can just be available, you can just buy and use. At least you know it is available, but you remember that there are side effects. Now when you are talking side effect, timolol, the eye side effects are less. It doesn't give you the redness like many other many other drugs. One of the things you can do to prevent this is when you are applying the drugs, you part your lower eyelid, put the eye drop, and block the space between the nose bridge and the eye, and close your eye for 5 minutes so that the drug is not absorbed in any other part of the body, so that you don't feel the side effect of shortness of breath and all that. That is if you must use the drug. Then this drug also come in combination with many other classes of drug. We'll come to the combination drugs. Then we have the alpha agonist. The alpha agonists they come in form of alphagan, brimondine, bricoma, brimopress, dufagan. The problem with this drug is a good drug, give you a percentage reduction of 15 to 20%, but it is not the first line drug that is given. The advantages are there, but when you take the drug, you can feel a little bit drowsy. There can be some stinging sensation inside the eye. You might feel pepper in your eye, you might feel redness in your eye, there is some allergic response. Some patients can also complain of cloudiness. Sometimes the allergy is quite significant. Okay, just know this is the cause of that. If you cannot tolerate, you let your doctor know. Sometimes the effect only lasts for few seconds and it will wear off.
Few seconds.
A few minutes, few seconds, 1 to 2 minutes, 15 seconds to 30 seconds. So for some people, it can last for 5 minutes. Some patients are never comfortable. So some of these side effects, when we are talking, it differs from patient to patient. Then we have the, then it also has an advantage of neuroprotection. It serves to protect the health of the optic nerve. It has a beautiful component, and it can also uh, be used in combination with other medication. Then you have the carbonic anhydrase inhibitors. This class is called, you have the dozolamide, brinzolamide. They are another class of beautiful drug, giving you 15 to 25% reduction also. So, but they also have some side effects. The side effects are just like cloudiness when you apply the drug. Sometimes you can have dry mouth, you can have a slippery taste in the mouth, tingling sensation. These are the eye side effects. Sometimes they also come with some burning sensation in the eye. So it is good to know some of these drugs have side effect. And the carbonic anhydrase inhibitors, they also have the oral form. The oral form is the one comes as Diamox, popularly called the Diamox or Zolamox. We only use Diamox when the pressure is out of control and we are truly helpless in controlling the eye pressure, and the patient is unable to take up other options that are available like the lasers and the surgery. So you just have to bring the pressure down. It has its own problem. The problems are that in the long run gives you tingling sensation. Sometimes it causes dizziness, palpitation, constant pain. So it is not at all a friendly drug, but some patients take it and they don't experience any side effects. Some patients take it and they have several side effects, so it is good to know. Then you have the myotics, that is, we have the pilocarpine. Pilocarpine is not actually used for primary open angle glaucoma. It is for angle closure glaucoma
Okay.
patients. It is just to keep the space open, so it doesn't come into our discussion today. Then we have combination drugs. Combination drugs are those that can be combined with prostaglandin with beta blockers. They come as combination. Some are combined with alpha agonists, some are combined with alpha agonist antimolol. So we have various combinations. These drugs are good because the advantage of having combination drug is that instead of a patient taking 4-5 drugs, you are trying to reduce this number of bottles to 2 bottles, but now they are having two bottles, but they have 4 eye drops in their hand, so which makes it comfortable for the patient, and compliance gets better when it is only 2, because it's you can imagine somebody carrying all the drugs in his pouch. So 6 bottles of drug you are carrying and going to work to pay putting, it doesn't look okay. So it is combination drugs makes one, pressure reduction better, to compliance and adherence to treatment better. So it is it is one way the doctors have found to manage glaucoma with compliance better. So there are the newer drugs that are on the online now. That is, we call it the Ropersa. It's a rho kinase inhibitor. It works at the level of the uvascular pathway as well as the trabecular pathway. So it is a beautiful drug. It is the new kid on the block. So we are watching out how it is performing. But some of these drugs I'm going to mention, the prices are outrageous. We have the Visulta, that is latanoprost bonoid. The cost goes up to $250 to $300. So when we are talking, are we going to afford such drugs? for now, they are still at the for those outside here. So those are the new drugs. There are also some injectable and sustainable release drugs that are coming in. Then we have the drugs for neuroprotection. We give some supplements. Okay, supplements
Okay.
like there are some eye supplements we give, but traditionally these eye supplements are known to promote the optic nerve head health. Then we also have some researches going on for vitamin B6, B3, B12. They are known to preserve the visual field. They are now looking at how to preserve the visual field, but these other drugs are at the level of research.
Okay. You've taken a lot of time to explain, and for the layman, he may not understand all of the jargon. But many people struggle with regular use. How dangerous is it to miss doses of glaucoma medication?
Uh, uh, it is good not to miss the doses of drugs, because when you miss the dose, the effectivity of the drug is not fantastic. But we are all human. When you miss your dose, the much you remember, take the dose that is there and continue as if the next dose you have to, like the latanoprost, the prostaglandin, that is night drug. Oh, I forgot, I slept off, I did not use it. In the morning, just as you wake up, put it. Then in the night, don't think that you used it in the morning, let me not use it in the night. Just continue the cycle as if it is the next night. You are taking it in the night and continue the following night, and the cycle goes on. So if you miss a drug, the moment you realize you missed the drug, please
Take
take
it
the
and
drug
then still take the one
and-
you're supposed to.
and take the drug as you are supposed to take for the next day. Don't miss your drugs. We also advise our patients, before your drugs finish, you know when your drug is expected to finish, and when this drug is going to finish, try and get your drugs before time, so that you don't have the lapse of 4 days, 5 days, I'm looking for money and all that. You know, 1 week from now this drug is going to finish. Make arrangement, get the drug, because most of the time you don't really have that window of keeping your eye and the optic nerve safe. So it is important that you continue taking your drugs. Okay, for any reason, don't withhold your drugs. Sometimes we also hear patients that I have been using this drug for a long time. Don't you think my eye needs rest? Please, your eye is not the for now. As long as you have this illness called glaucoma, your eye leans on that medication for survival. Because if you don't do that, the fluid will be forming, because it is,
And we'll
it
not
is-
find a way to.
and it keeps increasing the pressure. So it is important that you take your drugs to control your pressure.
Now, I've had somebody ask this question, so I'll repeat it. I know that will be a major concern for some people, especially for those who are no more seeing with their eyes.
Yes.
But you tell them to continue to take medication. So they're like, it's not logical. I can't see, so
Actually-
why should I keep taking my medication?
It is a very logical question. You have now bumped onto blindness. Why continuing and why wasting the money? Natural question. It is plausible, we understand. But then just know that you have gone blind, but you are still living. Your eye is still a living tissue. Okay? So the ciliary body that is producing the water, the aqueous humor that is being formed, is still being formed. Okay, so the pressure keeps rising. We have seen a lot of blind patients coming with pressures of 50, 60. Sometimes the machine can't even read because the pressures are too high, because the family itself
And the
thinks.
pressure will continue to affect them.
And when that pressure goes up, you have a lot of pain in the eye. There is redness, tearing. That pain cannot go with Panadol or ibuprofen or any pain relievers you see on the shelf. Okay, it will never go, and the patient has headache and pain. So the easiest way to handle, before lasers came in, the modality at that point was to remove the eye. Okay, that is, you are going to remove the eye. But now what we do is to go and do a laser. Sometimes when we say laser, they think vision is going to come back. No, vision is not going to come back, but you knock down the ciliary body so that the fluid will not be formed at that rate where it was being formed, so that the pressures are kept under check. So it is important that the patient takes the drug. What you might consider is, can we go for lower end medication first and see, can this medication sustain my eye pressure? If not, we opt for some other medications.
One of the opportunities this glaucoma awareness presents us is to get expert counsel. So if you're out there and you've listened, you can make the call right now, 0704 550 2840. You can also dial 0909 771 1009, 0704 550 2840, or 0909 771 1009. Hello, good morning. Hello? Hello?
Hello, good morning.
Good morning.
Steven from Mamori.
All right. Chidi, go ahead.
Yeah. Okay, I want to ask, what is that cannot see with his two eyes? And when he closes his eyes, his images. You know, when you're looking at the phone, you are seeing some images on the phone, and it's too bright to you. So that image comes to your eye when your eye is closed, or when your eye is open. Your eye is images coming to your sight, and it's very, very clear. But when you want to go out or do other things, you cannot see anything. But those images come to your sight. It's very bright, very clear. I want to know the eye condition. Is it glaucoma or cataract? That is what I want to know.
Did you get what he said?
Let me ask a question.
Okay, go ahead.
What you're saying
The
is
second question, what is this food? This food she's talking about, what is the consistent of? Is it a bacteria or an infection that this food that do gather to the eyes that will cause the pressure
hold
of the
on.
eyes to go increases or to damage the optic nerve?
Okay.
Thank you.
So before you go, she has a question for you.
Are you seeing with your eye, or you are not seeing with your eye?
No, I'm not seeing with my eyes.
Okay, I will answer you.
Okay, but then something comes like a flash and you can see.
Yes, like image. So it comes to my hand. It's very, very clear, very bright. I can identify the color and the shape.
That the person is wearing.
Sir?
You can identify color. Is it color of clothes or what?
Color of clothes. The images that comes to my sight.
Okay. She got you. Just keep listening. All right, let's take some more calls so that we can take all the questions at once. Hello, good morning. Hello.
Good morning.
Good morning.
Good morning. Dr. Okeke, good morning.
Good morning. How are you?
You see, this question, this is what I want to say. I have said it before when Professor Akariwa was in the studio.
Okay,
Dr. Okeke, please. The day I had my operation last year, you were in the theater with me, but you were working on another patient.
Okay.
So, the person who did my own surgery, when I came for visit, one of my visits, he told me that what they put in my eyes was not properly fitted in, that there was going to be another operation. So I'm asking Dr. Keke now, am I supposed to pay another money because it is not a different case? It is for them to correct what the mistake they made. Am I supposed to pay another money?
Okay. She will answer you. Just give her a moment. 0909-771-1009 or 0704-550-2840. 0704-550-2840 or 0909-771-1009. Hello?
Hello, this is CMC.
Yeah.
Afternoon, sir.
Good morning. What's the name?
This is Esos calling from Nightman.
I didn't get a name.
I said Esos.
Eso. Okay, go ahead.
Good morning to your studio, my madam in the studio.
You're welcome.
Please, my question is very simple. See, being a glaucoma patient, so I want to know whether there's any mode of lying down, sleeping. It hasn't gotten my side or one side of my eyes affected. One is completely down. So is there any mode of style of lying down, either face up or by the side? One can, be when lying down too, so that the other eye might not be completely damaged.
Okay. I think you have an idea. He already has an idea of face up. Okay, but then go ahead. Okay, let me take this last one. Hello?
Oh, good morning, Mr. Uche.
Yeah, good morning. That sounds like Onoja.
Yes, your friend.
You're welcome. Go ahead.
Thank you for good job. My friend had a complete eye problem. He doesn't see well. So he was told that the eye can be replaced artificially, either from goat eyes or sheep eyes, something like that.
Okay.
Thank you.
You want to know whether that's possible?
Yes.
Okay. While growing up, I had that too. But thank God we have an ophthalmologist that can tell us whether getting an eye of a goat can walk. Okay, it sounds funny, but that's the question. Go ahead. You can answer all the questions.
Okay, let's start from the first caller. Let's start from the last caller, Mr. Onoja. And you also agrees that he heard the same story as a child. Now, yes, it's a very good question. Beautiful thought that if your eye goes bad, let's replace it with another eye. Beautiful. But unfortunately, if your eye goes bad, as at today, anywhere in the world, why I said anywhere, that is science and that is technology. Eye cannot be transplanted at all. And don't waste your money running from Nigeria to US to India in the search of eye transplant. It does not exist for now. If you lose your eye, you have lost your eye. The artificial eye, sometimes you can lose your eye and your eyeball recede inwards. In that case, cosmetically you may not be looking good. We can do an artificial eye. Artificial eye is not pig or sheep eye. It is artificial. It's a ceramic eye. It is done in two phases. It will be implanted, but the eye does not see. But somebody looking at you, if it is downward, will not know you do not have one eye, but you have an artificial eye standing. That's the position. But a lot of research is going on in terms of what can be done, chips, implant, and all that. A lot of things are going on, but nothing has so far materialized. So we are waiting. Then the next question from the second to the last caller, Mr. Isom, you asked about one of your eyes affected and one is not affected. So it is very important that you preserve your eye that is not affected. And you said whether sleep position can affect your eye. Yes, don't lie on the eye that is still healthy, that side, try to have a face up position. It will help you better. And do not lie face down. Just try to preserve the side that you are seeing with. Don't apply so much pressure on that side. Then the person who said who had surgery last year, I wouldn't know the circumstance of your surgery. It is, if you have a challenge with your surgery, it is important to get back to the hospital and then sort it out, because your case history will really carry what your problems are, so that they can sort it out. As for payment and all that, the hospital will know what is the situation, what really happened in your eye, so that they can sort it out. Then the first caller, who is not seeing unfortunately, and asked about is seeing images, shapes, colors, and all that. Yes, it's very common in a patient who has lost sight. It is what you call the Charles Bonnet syndrome. Now, why it happens is that the way the nature has built it for you, God has made it, is that it is looking for something to see. We call it the visual stimulus. So that visual stimulus is not there, so it is trying to search for stimulus. We have phantom images that are not really existent, but in the psyche, in the mind, you are beginning to see something, so you feel you are seeing something, but you have not you are not really seeing it. This is a stage that one passes through before you really settle down with your loss of vision. But if you have loss of vision, please, there are other things you can do.
Is it psychological?
It's more of psychological. It's a mind
Okay.
kind of information that is happening. It's a psychological phenomena that is going on. The brain is trying to think. Something is being projected in the field, but when it is not there, before it finally loses its track.
Is that all the question?
Yeah.
Okay, we could take some more. We just have about 5 minutes more. 0909-771-1009. If you're quick, your questions can come in. Be fast about it. 0704-550-2840. 0909-771-1009. As quickly as I can, let's get the questions before we call it a day. It's been enlightening so far. Now, some people believe glaucoma medication cures the disease. We might want to clarify that misconception. I've heard you say repeatedly that it's what's remaining that is preserved. What is lost and gone forever. As hard as it sounds, but that's the truth. And that's the truth. Let's get your opinion on that.
A very good thought and very good question at this point. Just know that a condition like glaucoma is not curable. It is managed. Some diseases are managed. When you have glaucoma, if you come at a point you have 80% or 90% you have lost, we cannot give you back what you have lost at the point of presentation. The struggle now is the remaining 10, 20, 30% or even 1%. That 1%, no matter how small it is still significant, because it ensures you to move around at least. So
And that's why you say come early.
Come early. Make sure you are following everything. Anything you lost, it doesn't come back in glaucoma. Even though new researches are going on in terms of what can be done for preservation of lost sight, they are working on it, but whatever it is at the research level, and it might take another 10 to 20 years. So for those of us that are passing through this phase, we should know taking your medication as at when due is very important. Taking a regular check of your eye, for if you have already lost one eye, you really don't have a reason to play with your next eye. Anything that has to be done to the other eye should be done. For those that have family history of blindness or glaucoma, please run and go and check your eye. Even those that don't have any history, please, it is not bad checking your eye. Just check your eye, because your eyes are your sole source of independence in your lifetime. Once you have eyes, at least you wake up in the morning and know where you are going to. If you don't have your sight, you cannot do that. So take time, ensure that this eye that is helping you without you knowing that it is assisting you is very important to you. Give a day for your eye. Take time, check your eyes. It's not too much. Thank you.
Okay, and people always worry that glaucoma medications can be costly. Are there available cheaper options, that exist for patients?
The glaucoma drugs are, in the present Nigeria today, a lot of drugs are expensive, as a matter of fact. And you have to use this consistently, so it is quite challenging, but when you discuss with your doctor, if you have challenge and you sincerely understand you cannot use this medication for a lifetime, maybe you should opt for surgery, because most of the time when you do a surgery, it is a one time off. The surgery money might look big. You pay the money, you do the surgery, then you follow it up. So that might work for you. So these are the points you have to know. And if you have challenge, explain your circumstance so that the doctor juggles with the drugs available and give you the one you might be able to afford.
Okay. All right, let's get your closing remarks as we close.
Okay, so please ensure that if you are already placed on medication, take your drugs very seriously. Do not run out of your drugs. Those drugs are very important. Some of them, I failed to mention, needs refrigeration. So if you do not have a refrigerator, please store these drugs in an area that you consider cool in your house, or you can buy a clay pot and put it inside. Then from there you can use it to especially the drug you use in the night has this problem. Most of the drugs are fine. Then if you are traveling or anything, remember to pack your drugs ahead of time, just like carrying your toothbrush and towel and personal belonging. Put it there so that your drugs travel with you, because sometimes you travel to faraway places and you may never see the drugs, and your eye does not have that luxury. So prioritize your eye health. It is important. Just like if you have any health condition, pack your drugs and keep it one place before you pack any other things.
All right. Of course, this is where we call it a day. And as we close, I'm reminded of one of my favorite artists. He goes by the name Blessing Offor. He's from Imo State, but he's lost his sight. Lost one of the eyes at the age of 6. Then traveled to the US and then lost the other one. But he makes great music. So it's not a death sentence. And I'm hoping that in our country, Nigeria, we can have a better way of making people not feel useless even when they lose their sight. Now listen to Blessing Offor.